Hmm. राइट फ्लिकर कर रहा है स्क्रीन इसको। अच्छा। Right, like we're live. Hi everyone. Welcome to this recall session of the 26th July exam that just happened recently. I know I'm coming a bit late, but there is a reason behind this. As you all know, whoever took this exam, the paper one questions were relatively longer. So the students were not able to actually get the proper recall of the questions. They were just telling us the theme of the question. So based on this only, we have, just made few questions like whatever we could gather. So I got the exact number of questions that were asked from microbiology, but then I'm sure the language of the question that was asked in the exam was different. Okay. So please understand, we are here to make sure that we understand the topics from which the questions came and most likely the probable answer that you should have marked. Irrespective whatever it is, your inputs are still welcome. I'm sure a lot of language that is for the questions in this is not definitely the same. So any inputs, if you still have, if you are able to recall some things, please, you're more than welcome to always comment them in that section. Okay. So anyway, we'll get started with the very first question. A patient presents with pain and redness in the eyes. She wears contact lens and admits to maintaining poor lens hygiene. Which of the following is the likely causative organism involved in this situation? Now, in this, we must know they're talking about keratitis. Contact lens users, whenever the word come, okay, so whenever we use the word contact lens users, we must remember at least two organisms. One is a bacteria that is very important for us, known as Pseudomonas. And the second one, it is a parasite called by the name of acanthamoeba. So, this question is not a new question. Acanthamoeba keratitis has been previously tested in FMGE exam couple of years back. So, they just repeated the same question just by changing the language. So, this tells us something that if a question was asked on some topic previously, then you should be thorough with that topic. All right. That's why we always, tell you that you have to do the PYTs, right? That topic needs to be revised properly. And this is the whole purpose of us, creating this recall sessions so that the upcoming batches, they are benefited from this. They get an idea like what topics were tested in the previous exams and they also prepare well. So it's a chain of events, as you may understand. You were helped by somebody, now you're going to help someone. All right. So with this current, situation right in front of us, the best answer will be acanthamoeba keratitis. Okay, so that will be our answer. Next question is, a patient presents with the fever and altered sensorium. Peripheral smear shows multiple rings in the RBC. Diagnosis of Plasmodium falciparum was made, which is resistant to chloroquine. Now, these were the words that were told by students to me. They said that, sir, it was mentioned that this guy was resistant to chloroquine. Sir, first of all, you must understand that falciparum is resistant to chloroquine. They didn't even have to mention that point over there. Okay. Now, we in our classes have already learned that there is a mnemonic called very cool fact, where the word very means Vivax. Vivax, the drug of choice is chloroquine. Next, the word fact. F stands for falciparum, where the treatment is ACT. ATC stands for what? It is artemisinin combination therapy, right? Artemisinin combination therapy. So that we all know. But now here they're kind of giving you a situation of a complicated malaria, right? Altered sensorium means most likely it is a case of cerebral malaria, right? It is a cerebral malaria. So you and I must all know that if it is cerebral malaria, we have to give the drug like IV artesunate. Okay? If it is a complicated malaria, we have to give the drug called IV artesunate. So with that, we are going to conclude that this should be the correct answer for this. What about the other options? You must know that the drug called primaquine, it is given in the Vivax cases for 14 days to prevent the relapse of malaria. Okay? Quinine drug, it is used in falciparum, but for falciparum, it is used in pregnancy. And obviously, chloroquine is already resistant, so C cannot be the answer, right? Even if they might have given some other option like mefloquine or something else, that cannot be the answer. So from the given option, artesunate becomes the best answer for us. All right. Now, next question. This is the one in which I didn't get the options. Majority of the students who sent me the question on the day of exam, they told me, sir, we got a case of rabies. A woman was bitten by a rabid dog. The dog developed the symptoms and the dog died within a week. They were specifying that the dog died. We all know that we usually notice the dogs also for 10 days or so whenever, some dog bites a human being. We just want to make sure, is the dog rabid or not? If the dog has become rabid, that means infected, the dog itself will die. And that also tells us most likely the human is also infected. So now suddenly the question switches in this and they ask the human diagnosis, what is the best method for anti-mortem diagnosis of rabies? See, one of the options students said is Negri bodies. Negri body cannot be the correct answer in this. Simple reason, Negri bodies are for post-mortem diagnosis. They're not for anti-mortem. They're asking when the person is alive, then what is the one that we have to go for? It's not Negri bodies. Cellular staining is used for the staining of the Negri body. So obviously this cannot be the answer as well. Brain biopsy or whatever, what you do, it's all going to be done for the post-mortem, not for the living person. So that's where I'm left out with two options. I'm not sure exactly if this were given. You can, comment and let me know in case there was something else. DFAT stands for direct fluorescent antigen testing. Okay? Direct fluorescent antigen testing, where we use some antibodies to do this testing. So basically, we are detecting one antigen called nucleoprotein. Okay, nucleoprotein, which is an antigen of rabies. So DFAT primarily becomes our testing over here. If DFAT was not there, then PCR also is a great option. So PCR and DFAT are the ones that we prefer for anti-mortem diagnosis. But if PCR was given in option, I'm sure all of you must have told me that. But they said, no sir, PCR was not there. Okay, so I'm assuming most likely they might have given a long name of the test, that is direct fluorescent antigen test. Alright, so that becomes the best answer. So make sure for the upcoming exams, you also know the management of rabies. How do you, manage the category 1, category 2 or category 3 patients? Alright. Next question is, a 35-year-old HIV positive patient presents with fever, dry cough and breathlessness. Chest X-ray shows bilateral interstitial infiltrates. The CD4 count of the patient is approximately 150 cells per mmQ. Which of the following is the most likely cause of the pneumonia in this patient? Alright, see, we must know something, that whenever they're talking about HIV, you must keep in mind the normal organisms which cause certain diseases can always happen in HIV. Example, pneumonia is caused by strep pneumo very commonly. So strep pneumo infection can happen in HIV. Plus on top of that, some unique infections of HIV can be seen as well. They're called opportunistic infection, yes or no? Example, pneumocystis. Pneumocystis is that agent which we see in HIV patients and it's going to cause pneumonia. So sir, I am actually having both the options. Okay. Strep pneumo also is in the option. Pneumocystis is also in the option. Strep pneumo can cause pneumonia in normal people also, HIV people also. Whereas this guy, pneumocystis, will cause the pneumonia in HIV people. So, how am I supposed to choose this answer now? See, they gave interstitial pneumonia. If they gave lobar pneumonia, I would have most likely chosen strep pneumonia. But since they gave interstitial pneumonia, the best answer in this will become pneumocystis jirovecii. Okay, so pneumocystis jirovecii, this becomes our best answer in this. All right. Next question is something slightly offbeat. Human papilloma virus infection, it is associated with which of the following types of cancer? Now, unlike the typical thing which we know from the HPV, that is cervical cancer, they didn't ask that. They gave some other cancers in the list. And from the given option, the most appropriate answer will be oropharyngeal cancer. Oropharyngeal cancer. If you remember, when we were learning the serotypes of this virus called HPV, we said 1618 causes cervical cancer. And we have also learned that there are, other strains, example 611, which are associated with the laryngeal problems also. So that's where they can cause the oropharyngeal cancer. Okay, so that's what we'll remember. Basically, apart from the cervical cancer, this guy can cause even this. All right. Now, this image, whether this was an image-based question or something, but students told me that there was a question on SSSS. We all know there is something called staphylococcal scalded skin syndrome. All right. Now, the way I used to teach you in the classes is scald means a burn, right? We used to learn that scald means a burn. So what happens when we get a burn? Our skin starts to peel off. Our skin starts to peel off. So that's what's going to happen here. You can see in the image that the skin has started to peel off. So peeling of the skin is known as exfoliation. That's why the toxin that does it, it is called exfoliative toxin. Okay, exfoliative toxin, or also known as epidermolytic toxin. So that's what you must know, that this is an image of staphylococcal scalded skin syndrome. All right, so that becomes the most appropriate answer in this situation. Next is a child presents with raised, pink bumps with central umbilications. Identify the causative agent. Okay, this is a direct question from the last, important question series that I did on the Medway. I had put this question with the image. And there are certain more questions that came from that, important question list. So definitely the topics which are important are always important for exams. They will be repeated with some different type of a question language. So sir, raised pink bumps. Usually I teach you guys that this is dome-shaped lesions with central depression. Dome-shaped lesion with a central depression. They're called central umbilications, right? So this is a straightforward diagnosis of somebody called molluscum contagiosum, which happens to be one of the pox virus, right? So this is nothing but molluscum contagiosum, that is a pox virus that we must all keep in mind. Okay. Now, next question is, a 25-year-old patient presents with vesicular lesions over the lips and oral mucosa. Vesicles, whenever you hear the word, especially in the microsection, you must know it may be herpes. All right. A Zank smear prepared from the lesion reveals multinucleated giant cells. Okay. Which of the following is the most likely agent? My friends, we need to all understand something, that is, once again, this is a PYQ. Not far. Just within the last 3 years in FMG, they have asked about the Zank smear. Okay, Zank smear. So again, it's a repeat question that they have asked. Zank smear, it is done for 3 herpes, namely HHV1, HHV2, and the 3. Right? So HSV1, HSV2, and the HHV3, that is varicella zoster. So we'll simply write down that this Zank smear will be done for HSV1 and 2 and the HHV3, that is called as Varicella zoster virus. Varicella zoster virus. So now that we saw this, okay, the best answer that we can go for in this will be herpes simplex. Okay, so this is also a repeat question, in the recall questions, etc. Previously, I've already discussed this. Okay, so 1, 2, 3. That's it. Next, 25-year-old male presents with high-grade fever, retroorbital pain, and maculopapular rash. Tourniquet test is positive. Which of the following is the most likely diagnosis? Okay. Now, you must remember retroorbital pain, etc. When they give, it might be very important clue in your exam. Either they are hinting you towards something called dengue fever, or one more thing called Weil's disease that is caused by leptospira. But in leptospira, there might be more hints that they will give you. Okay, so this word is very important and catchy. Now you can see there is a rash also in the body. Rash with retroorbital pain along with fever, this is none other than your dengue fever. And they've given you one more hint to confirm this, that is tourniquet test. Okay, tourniquet test, if they gave you this word, then that becomes super easy. You should go for dengue fever. Okay, dengue fever. And this is once again from that important question list. All right, so dengue fever, similar question we had discussed, that is with the rash, fever, etc. Okay, so that's about it. Next, a 32-year-old street food vendor presents with high grade fever and a black lesion on his upper back. He reports handling raw goat meat with bare hands 5 days ago. Examination reveals a black scar with surrounding edema. What is the most likely treatment? See, black scar once again is a favorite word. You must know, if you ever see scar, especially in a micro type of a question, most likely they're testing you either anthrax, or they might be testing the scrub typhus, which is caused by rickettsial group of organisms. Yes or no? So either it is scrub typhus or it is rickettsia. So what I am telling you here now, this one is scrub typhus. All right. So they've given the history, like handling the meat, etc. So basically animal contact. So based on that, we are just taking that hint. And the scrub typhus, or for the rickettsia in general, the drug that we generally use is doxycycline. Okay, doxycycline. So that's where, and I think we have a decent amount of questions coming from the antimicrobials this time. From what I could gather, this is one question, and there's several more coming up. Okay. Next is identify the virus that is shown in the image. Okay. I'm not sure how many things from this they were labeling, they have labeled in the exam. But if you see H and N in the name, H and N, you all know there is something called H1N1, H5N1. That's none other than your virus called influenza virus. Okay, that is influenza virus. So this is primarily influenza virus. Okay. Now, image-based questions you can expect. Earlier also they have done this in the previous FMG exams. They gave HIV picture and they have labeled one or two parts and they asked which virus is this, and you had to answer HIV based on one of the antigens, that is GP120. So a question of similar sort has been already asked. So there are like 4 or 5 viruses. We need to make sure that we know their structures properly, and influenza is one of them. Okay. Next will be an HIV positive patient presents with diarrhea. Stool microscopy reveals cyst measuring 11 microns. Which of the following is the most likely causative agent? Okay. Now we must all know certain things when it comes to the cyst. See, whenever you have a case of a patient having HIV plus diarrhea, okay, so whenever we have somebody having HIV plus diarrhea, we all must understand that this leads to certain infections from parasites, right? This leads to infection from certain parasites. So what are these parasites? One is Cryptosporidium, second is Isospora, now known as Cystoisospora, and third one is Cyclospora. Okay, third one will be Cyclospora. So now some size was given. See, this size, obviously certain students were saying certain number, certain students were saying certain number. So I'm not sure what exactly the number was. Okay, so that's where we will do something. If Cryptosporidium is the answer, Cryptosporidium, the size will be roughly 4 to 6 microns. So according to the 11 microns, that cannot be the answer. Okay. Next thing, if you talk about Cyclospora, the size will be 8 to 10 microns. So roughly speaking, if it is around 11 micron, I would have chosen Cyclospora. And lastly, the biggest of all, that is Cystoisospora. Okay, this guy will be roughly between 20 to 30 microns. Now again, is this a typically new question in your exam? The answer is no. A question on HIV plus diarrhea has already been asked in your exam, but what they did back then is they gave the picture of the cyst of Cryptosporidium. It was an image-based question. Then they asked what is the causative agent. We had to choose Cryptosporidium. But this time from the same topic. Again, the same reminder, PYT, PYT, PYT. You have to read that full topic properly. So here's where now, if 11 micron was given, my answer is going to be Cyclospora. Some people said it was around 20 micron. If it is 20 micron, then my answer would have switched to Cystoisospora. Okay? So irrespective, let's not fight about this. Whatever the size was mentioned, this will be the correct answer accordingly. Okay? Next is a 6-year-old child presents with multiple skin-colored papules with central umbilications over the face and the trunk. Okay, what is the most likely agent? Okay, so this question we have already discussed. It is none other than your herpes simplex virus. The molluscum contagiosum. So again, we don't need to discuss this. So that's pretty much done. Now comes the next question. A 30-year-old man develops profuse vomiting and diarrhea within 3 hours of consuming some salads and milk at a picnic. There is no history of fever. Which of the following is the most likely causative agent? Okay. So, dear doctors, you must know that food poisoning also is one favorite question from microbiology they always ask. Something they will give and ask you to figure out. There has been question about seafood poisoning, which is Vibrio earlier. There has been question of Chinese fast food poisoning, that is Bacillus cereus. So, food poisoning question will come. Now, dairy products or salad, especially potato salad, custard, this kind of substances, the moment they mention, you should choose Staph aureus. So I was told Staph aureus was not given, only Staphylococcus was given. So yet I'm going to go for the Staphylococcus answer. Okay. Clostridium perfringens comes with meat. Alright. Next, Bacillus cereus, Chinese fast food. Staphylococcus, as we already discussed. Alright. Next, you should also keep an eye on Clostridium botulinum. Right. That guy also is important. It is seen with usually, home canned foods. Anything that you have packed at home, because we don't add preservatives, that can again lead to food poisoning. Okay. Now, in an experimental study involving the antigen injection in humans to study the immune response, which of the following antibodies appear first after antigenic exposure? Okay. So, they're just twisting the language, but the theme of the question is, what is the first antibody or the earliest antibody to be formed? That's what is the story. We all know when you're infected with something, the first antibody we always find is IgM. Yes or no? IgM. So that's why IgM becomes the antibody for the acute infection or recent infection diagnosis, whereas IgG is for the chronic. So no second thoughts about this. This answer has to be IgM. Okay, so this is where the answer is IgM. All right. So I told you, you can go and check if you want to in the important questions that antibody pe question aega. Mostly from immunology, they love this topic. Okay, once a year at least, something or the other, either some properties of an antibody, structure of an antibody, something like this they will ask. Okay. Next question is, a child presented with fever and sore throat. Throat swab culture on chocolate agar reveals the gram-negative cocobacilli. Which of the following organism is it most likely? Okay, so chocolate agar. You may think I'm just saying this. Go and look in the in this important question series. You're going to find exactly these ones. Like if you talk about the blood agar, chocolate agar, we have discussed the one which is the correct answer in this, and that is Haemophilus influenza. Okay, Haemophilus influenza. This is that exact thing I discussed back then. You may refer to that, but I'll just give you a quick, overview about this. You can look in the name itself. There is heme. Heme means blood. It is blood loving guy. It is blood loving guy. So guys, there are two blood agars, right? Unhemolyzed blood is called blood agar. Hemolyzed blood is called chocolate agar. So they were just giving the hint, chocolate agar. So I will go for Haemophilus influenza. Okay, that will be our exact organism. Next, a diabetic patient presented with white plaques in the oral cavity. A KOH mount confirms the presence of budding yeast with pseudohyphae. Which of the following is the most appropriate culture medium for the isolation of this organism? So primarily we got two questions on the culture media. Culture media. Okay. Um, Welcome everyone. I am actually looking at the chats right now. Dr. Lucky, Mr. Unknown, Dr. Saf, Dr. Shah, so Pani Puri. You're giving me the inputs. Thank you very much. Yeah, I got to hear that Pani Puri word. Some of them said, but I thought maybe they're just saying it like that. Either ways, thank you for the input. So now you can see diabetic patient with something called oral thrush. You must know for all of the fungi, we have learnt only one culture media, the main that is called as SDA, Sabarods dextrose agar, right? So here there should not be any second thought. This is SDA, that is Sabarods dextrose agar. Okay? So this is one image that is revolved in your exam like quite commonly. I'm not saying this exact image, meaning the oral thrush. Next time you may expect they may give you a pharmacology question on this. They will ask you which of the following drugs do it. You must know that the inhalation corticosteroids we use in asthma, they will do it. They will cause this side effect. They can ask you the treatment. How do you treat it later? Okay, we can use something called cotrimazole. Cotrimazole, that is the drug we are going to apply on those patches. Okay. Next, a 38-year-old farmer presented with fever, malaise, diarrhea for 5 days. On further history, he reports that there is a regular exposure to animals. Okay, regular exposure to animals. There is no history of tick bite or flea bite or anything, and there is no rash on the examination. Right? The person on the body does not have any rash. So, which of the following organism is it most likely? So, sir, you must know if you're talking about the cattle, if you're getting exposed, right? It may be something called Q fever. There is a diagnosis called Q fever, query fever. Okay. Now, you must know that this Q fever is acquired by getting exposure to this livestock, that is cattle and all. Imagine their placenta. So this Q can be imagined as the animal placenta. So Q fever comes like that. And the causative agent of this Q fever is Coxiella. Okay, the causative agent here, it is going to be Coxiella organism. Okay. So that is one more question that has come actually from the rickettsia. Earlier they have asked about the scrub typhus treatment, and this is one more question that they have tested. So I think with the history, animal history and all those things, they have asked decent amount of questions. Okay. Next, which is the opportunistic pathogen that will show this crushed ping pong ball appearance on the stain called GMS. Now, this is a very classical picture that we have discussed during our classes also, where I told you that this is an organism called pneumocystis, which shows this crushed ping pong ball appearance. They are actually the cyst of this agent. Okay, so this GMS stain, you must know it is the G for green color, G for green color. That's how we recognize it. And the crushed ping pong ball, it's the pneumocystis, the guy who causes the pneumonia in HIV. So I believe there were two questions on pneumocystis. One was this crushed ping pong ball appearance. Another was with that CD4 count, right? CD4 count was less than 200. We know we may expect the pneumocystis that time. So 150 or some CD4 count was given, and they've asked another question in our exam last time, right? So no more confusion, and you should know the treatment for this. It's called cotrimoxazole. The treatment for pneumocystis is called cotrimoxazole, which is a combination of two drugs known as TMP plus SMX, trimethoprim plus sulfamethoxazole, right? So cotrimoxazole is the treatment for this. So things here and there, they will keep switching. This time they've asked micro on this. Next time they will ask the antimicrobial, something of this sort. Okay. Next is a woman presents with sudden onset, high grade fever, hypotension, diffuse rash, and a history of using a tampon for a longer period. What is the most likely diagnosis? A very classical presentation. If you check our notes also, I always told you one buzzword. If they give you tampons, they are asking you straight away something called toxic shock syndrome. The name itself tells us that there will be shock in this patient, right? There will be shock in this patient. So no wonder you are able to see something that is hypotension. So this guy, okay, this guy is again caused by staph aureus. So I see there has been a plenty of questions from the staph aureus this time. One was this toxic shock, another one we saw was the food poisoning also. Okay. I can see Dr. Saf is saying another question on anthrax, farmer history, and cattle history. Okay. So was it a micro question, Dr. Saf, or was it pharma? Like, I'm not sure. Maybe that question is coming, in my slides only later on. So I was like fully busy with the classes and everything. That's why I wasn't getting time to actually, form the questions and everything. But somehow we did it now. So in case if I missed out something, because this is something that students told me that in paper one it was very lengthy. Micro questions also, I'm sure they were like 3-4 lines, whatever it is, but they were doable, right? They said that micro questions were plenty in our exam and they were mostly doable. Okay, so that I'm happy. So all right. So from what I'm seeing, you guys are saying that anthrax pe question aaya tha, and so you guys chose the answer. Awesome, awesome. So already, you know what? I have like 22 questions in my slide. So 22 questions, which I always tell you, average 20 micro se aate hain. So they have done it this time also. Okay. It took us a while to gather it. Initially, students were saying that many questions were not there. But now, you guys are live also. Many of these questions were actually there in the exam. Okay. Now, a 4-year-old child is brought to the emergency department with complaints of sore throat and a low grade fever. On physical exam, multiple vesicular regions are noted on the palm, soles, and oral mucosa. What is the most likely agent? Okay, ये तो easy था, boss. I think everybody in this exam must have answered this correctly. Okay, so palm, soles, and this. That means it is the hand, foot, mouth disease. Okay, hand, foot, mouth disease. So obviously we should go for Coxsackie A16 or simply Coxsackie virus A variety, right? So that's it, hand, foot, mouth disease. Again, I'm reminding you, this has been a question, but quite an old question. From my memory, it was asked roughly like 6-7 years back. They gave the image directly. They gave an image where there was a rash on hand, feet, and mouth. You just had to answer what is that disease, hand, foot, mouth disease. This time I think they didn't give any image, they describe in wordings and they asked. Okay, still easy. And you must also know there is a drug that is associated with something called hand foot syndrome. Not hand foot mouth disease, hand foot syndrome. It is an anti cancer drug called 5-fluorouracil, or its prodrug called capecitabine. Okay, 5-FU or capecitabine. Okay, next, a diabetic patient presented with black lesion near the nasolabial fold. What is the most likely treatment to be given to this patient? ठीक है, समथिंग विद म्यूकोरमाइकोसिस, बट many of the doctors told me कि सर कुछ nasolabial fold का दिया था. So based on this, I am seeing this. So obviously, if it is diabetic patient plus something black color area, so we all know the diagnosis, it is mucormycosis. I was actually doubtful whether this question was asked because suddenly they are waking up and they are asking mucormycosis, which was an older question, right? They asked this during the COVID back then. So if it's that, then amphotericin B logically will be the answer, because for any severe infection, the treatment in fungi mostly is amphotericin B, right? So any severe, and this is a severe infection, kills you, right? So mucormycosis, this is the one. ओके, सो डॉक्टर मनी धीरज इज सेइंग पढ़ने में ही बहुत टाइम निकल गया सर इस बार. येस, आई एग्री. लाइक मैनी स्टूडेंट्स टोल्ड मी कि सर क्वेश्चन के टॉपिक्स वर नॉट समथिंग विच इज़ आउट ऑफ द ब्लू, बट द क्वेश्चंस वर वेरी लेंथी. इनफैक्ट आई केम टू नो पेपर 1 एंड पेपर 2 दोनों में देयर वर सम क्वेश्चंस लेफ्ट फॉर सर्टेन स्टूडेंट्स. टाइम मैनेजमेंट नहीं हो पाया. Okay, I agree. तभी in the beginning I said this time paper was definitely on the lengthier side. Okay, तो अब इसी में यही होता है, right? The more MCQs we practice, then the art of quickly catching the buzzwords become little bit easier. Okay, we can't say that MCQ कर लिया तो सब हो जाएगा, but at least it becomes slightly better. That's something like I guess we all can say. So good. ये भी था ना Dr. Saf? Okay, so you guys are confirming the questions also, that I'm glad. Next, there was a question on brucellosis treatment, I guess. Brucellosis ka bhi treatment. So falciparum treatment, they've asked about scrub typhus treatment, amphotericin B for your mucormycosis and brucellosis. That means seedhe, if you can see, there were 4 antimicrobial questions that we have already seen. So brucellosis, they keep asking this once in a while. Mostly for NEET PG, they would have asked this, but this time they asked this in your exam as well. Okay, so the treatment that we have to give is rifampicin plus doxycycline. Okay, so it's a combination treatment that we generally give for brucellosis. So anyway, just confirm, was this there or no, brucellosis ka treatment? I'm not saying that brucellosis question was directly asked what is the treatment for brucellosis. Maybe animal history was given again. Because brucellosis causes something called undulant fever, which looks like typhoid. So they might have given a case scenario to you and then they might have asked you what is the treatment. Okay, so whether there or not, it's all right. Then I can omit this question. And I guess that's about it. So we are all done with this session. Irrespective, thank you for joining in, and I hope you guys rock this exam. When we come out from the exam hall and we take your review, like how the exam went, every time the students say the same thing, that is, sir, we don't know. Obviously, if I was in your place also, same story. Nobody can say whether we'll pass or not. Okay, so when the results come, it's a totally different story. So we are hoping that you guys do very well and you guys clear this exam. And thank you for giving all your inputs and everything. Okay, so take care, everybody. I'll be logging off. And anything else, you can message me on my Instagram, as you know. Okay, it's all right, Dr. Imran. You know that in every exam they will screw up certain subjects or the other, right? Every time it happens, one subject or the other, they will do something. and that is an expected thing. Okay, expect the unexpected. That is how this exam works. So do not think everything will come, easy all the time. So yes, whatever it is, irrespective, you have attempted this, and we are all praying for you that you pass this exam. You will do well. Okay, so take care.